Welcome everybody to today's episode of the Great Birth Rebellion podcast. My name is Dr. Melanie Jackson at Melanie the Midwife. I'm a clinical and research midwife with my PhD. Our Great Birth Rebellion premium members also get access to podcast transcripts, additional resources, the Ask Mel a Question button, and an exclusive monthly Ask Me Anything episode. That said, let's get into it. Welcome to today's episode of the Great Birth Rebellion podcast. Today we're talking about cord clamping. We aren't talking about optimal timing for cord clamping. That will be for another day. I'm talking about the actual practice of cutting and clamping or tying the cord with a plastic clamp versus the cord ties or the cotton threads to tie the cord. Today, you'll learn about why we tie or clamp the cord at all. What would happen if we didn't do either? We're going to talk about the history of cord cutting and clamping with a cord clamp and why we started doing that in the first place over the original technique of tying it with a thread. And then we'll look at cord clamping versus cord tying and is one better than the other? I know you're going to be surprised by what you learned today because as I was preparing, I was surprised. I learned some new stuff. That means you are going to learn some new stuff. So let's get into it. Let's be clear from the beginning that the only purpose for clamping or tying the cord and cutting the umbilical cord is to detach the baby from its placenta. There's no medical reason why this is necessary. We know that if we don't cut the cord and left the placenta attached, that the cord and placenta would still dry up and detach, and that this would happen in approximately the same amount of time as if it were cut and clamped or tied. And this is called a lotus birth, so we know it's possible. We've seen it happen. So clamping and cutting the cord is in no way an essential task. I've seen cesareans be performed whilst keeping the placenta attached and where we've needed to resuscitate the baby and it's still attached to the placenta that's inside the mother. This can be done by the bedside in most circumstances. And I know lots of people say that they can't, when in actual fact it can be done, they just won't. And I know this because the times I've had to resuscitate a baby, it's always been done with the baby still attached to its placenta inside the mother or whether the placenta is outside and with the mother. So if someone refuses to do it, it's not because they can't, it's because they won't. Now, in very unwell babies, the umbilical vessels can be used to access the baby's circulatory system to deliver life-saving treatment and medicine. But this is reserved for very sick babies and would require cutting. That would be the only real medical reason that I can think of. But overall, routinely cutting the umbilical cord is not a medical necessity. So if it's not a necessity, why do we do it? We do it because most women don't want to keep the placenta attached to their babies. There's usually a point within the first few hours of birth where women are ready to detach the placenta from their baby, but if you just cut it and don't tie it or clamp it, there's a risk that the baby's blood can leak out of the baby and they hemorrhage from their umbilical cord. I'm not saying that to scare you, and there will be people out there saying, oh, it does not. I can hear you from here. But I have seen this happen with loose cord ties where the umbilical cord was tied but not tight enough and the baby loses lots of their blood volume through that site. Now, in the first day at least, the 3 blood vessels in the umbilical cord are still a bit open. Although there's a physiological process for closing them off inside the baby's body, they're still open enough to allow some blood flow and blood leakage. And it's direct access to the baby's internal blood vessels and circulating blood. So I do believe that if the cord is cut, it either needs to be clamped or tied or sometimes cauterized or burnt in order to close off those umbilical blood vessels to prevent blood loss. The second reason it's done is that the umbilical stump is considered a type of open wound that also offers direct access to your baby's circulatory system. And this offers a site for infection that can have effects on the whole of the baby's body, not just the umbilical site. In more developed countries where we have clean or sterile equipment and hygienic living and birthing conditions and education and access to healthcare, umbilical infections that progress to a life-threatening stage are very rare. However, we can learn lessons from less resourced countries, which is a very different story, and there's quite a high level of babies who can suffer from or die from infections that were acquired through their umbilical cord. So a tie or clamp can create a circumstance where the blood vessels are completely closed off and can hopefully prevent inward and upgoing pathogens that might create an infection. So let's talk through the history of cord clamping with an actual cord clamp, but also with the ties. So we know from historical texts that in more, I'm going to use inverted commas, primitive cultures, the cord is not cut until well after the birth of the placenta, usually hours later. And this is certainly the practice for most midwives who are prioritizing physiological birth, is that the placenta is usually born still attached to the baby, and detaching it becomes an afterthought in the care process. It's not an immediate or rapid circumstance that happens. We recognize the need for the baby to remain attached to its placenta as long as the woman wants it to be, and at least until it's white and empty of blood. And this seems to be what was done historically by traditional midwives, and it's only changed with the introduction of male midwives or male physicians that started encroaching on birth. So the first records of cutting the cord before the placenta's been delivered hailed from the 17th century. And it was linked to changes to the management of the placental birth phase, which, as I said, was accompanied by the emergence of males being present in the birth space, so male midwives or male physicians. And they started instituting it to become a normal thing for women to be giving birth on the bed. It was kind of required if they were there. And so this decreased the likelihood of spontaneous birth of the placenta, and it started to necessitate the manual removal of the placenta. They believed that if they didn't get the placenta out rapidly, that the uterus would close over it and it would become entrapped. And this was partly suspected to be due to the fact that the women were lying on their beds, and placentas require some gravity usually to come out if they're going to be born under maternal effort. So part of the practice of removing the placenta was to detach the baby from it. And the other reason was because they were all on the bed. There was a few research papers that I read, and you can read them too. They're in the resource folder. A few articles suggested that practices around cord cutting and placental birth changed in order to spare the bed linen from being soiled. And there was a paper written in 1968 by Botha that examined the early literature on cord tying or cord clamping. This author looked at papers from 1668 onwards and found that the neonatal tie or clamp was initially employed to avoid blood loss from the baby before physiological closure of the umbilical vessels. So this was the original method, is that the clamp or the tie was used to stop blood leaking out from the baby. But the two other reasons that emerged for clamping the placental side of the cord was to identify when the cord lengthened to indicate separation of the placenta, and as I said before, to spare the bed linen. And so this author, Botha, stated that the reasons given for the practice of cutting and clamping the cord early were not sufficient to justify early clamping and cutting of the cord where the placenta was still inside the mother. What I'm trying to say is, traditionally, historically, physiological birth was honoured in a way that the cord would not be cut until the placenta was born and empty. And clamping and tying became a strategy that was adopted closer to the birth with the medicalisation of childbirth, with the introduction of male midwives and male physicians and giving birth on the bed, and the interest of maintaining clean bed sheets. Now, this paper also talks about the practice of cutting the cord before the placenta was born started to quickly become routine despite actual warnings from the wise minds of the day stating that it was not a good idea. So in 1773, Charles White wrote that the common method of tying and cutting the navel string in the instance a child is born has nothing to plead in its favour but custom. So read, the only reason we do it is the workplace culture. And in 1801, Erasmus Darwin wrote, another thing very injurious to the child is the tying and cutting of the navel string too soon, which should always be left till the child has not only repeatedly breathed, but till all pulsation in the cord ceases, as otherwise the child is much weaker than it ought to be. So here we can see that somewhere around the 1700s, the method of tying the cord was the norm, because they talk about the tie, but also as birth became more medicalized, the tying and cutting was happening quicker and quicker. And in 1899 is the seeming first invention of what they called the midwifery surgical clamp by a guy named Edward Manginnis. I probably didn't say that right, but you can see the actual written document about this clamp. I've put it in the resource folder. It's super interesting. Edward has written a paper, and you'll see it in the resource folder. When prior to using a midwifery clamp, what he's called a midwifery clamp, they did use a tie or a thread. And the clamp was introduced because it was thought to offer better closure of the umbilical vessels and therefore preventing blood leaking and infection. So it seems like this issue of infection and blood leaking from the cord was still an issue. Interestingly, the inventor, Edward, whose last name I can't pronounce properly, the inventor of this device specifically states that it should be used after the umbilical cord has stopped pulsing and is empty of blood, and then this device could be deployed. And then in the paper also offered the opportunity that if the person using the clamp wasn't confident with the clamp, you could still tie it if you wanted to, if you were concerned about blood loss. So the practice of clamping with a device was first thought of around 125 years ago. You can see the paper in the resource folder. You're welcome. I know, so interesting. And metal clamping devices continued to evolve from 1899, but really, I think what probably led to the abolishment of the use of the cotton ties, or less use of them, ultimately is the time they take to apply. They really work well once the blood is empty from the cord, and something occurred in the 1950s that was probably the nail in the coffin for delayed cord clamping and the routine use of a mechanical clamp over a thread. And that was the work of Dr. Virginia Apgar. Yes, Apgar. Midwives and doulas and doctors and some women will know the significance of an Apgar score and what an Apgar is. So in 1953, Virginia Apgar published her first paper about assessing the well-being of a baby at birth and proposed the use of an Apgar score. Sounds reasonable? But the problem is that her original tool, which we still use today, we still use Apgar scoring, her studies excluded babies that were born during what she refers to as natural childbirth, where the cord was left attached. And the work of Virginia Apgar was all and only based off babies who had their umbilical cord clamped and cut before 60 seconds. And this gave rise to the immediate cutting and clamping of the umbilical cord to facilitate the conditions proposed by Virginia Apgar to take an Apgar score of the baby. Many people will say that medical management of placental birth with the use of artificial oxytocin and active management was the reason for rapid cord cutting, but I'm going to hazard a guess that the routine use of Apgar scoring has something to do with it. Virginia Apgar suggested that the initial score at 60 seconds after birth is determined after, and in inverted commas, clamping or tying of the umbilical cord. So she was still using ties, but as part of Apgar scoring, babies were assessed at 60 seconds after their cord was clamped or tied. So I'm going to suggest that clamping became of interest around this time because it facilitated the rapid cutting and clamping after birth while the cord was still full of blood, whereas more historical texts would suggest that the clamping or tying should only be done once the cord was completely empty of blood and white, in which case I do believe tying would be way more effective. If you try and tie a cord full of blood, you're going to end up with some leakage. So what do we know now about the use of clamps versus a cord tie? So let's look at clamps first. Firstly, they are easy to use. You take them out of the package, put it over the cord. I usually give it a few centimeters from the umbilical stump, and you push down and clamp it on. There's not a lot of skill required. Just don't clip any of little baby parts in it and you've done it right, so long as it's clipped down firmly. They're sterile, clean, and they're easy to dry and clean if they're soiled. They are removable. I have a cord clamp remover that I will deploy around day 1 or 2 to remove the cord clamp off the baby's stump because they are quite bulky. The downside is that they cost money. They can be hard to access if you're just a regular patron in the community. It's a medical apparatus, but they are universally accepted as the new normal. They are very effective in preventing leakage because they're so tight and there's very little risk of user error. But parents do report them to be bulky and difficult to navigate with the nappy, which is why I do like to snip them off. Once the umbilical cord is dry, then there's no risk of any blood leaving and there's very little risk of pathogens being able to move down a dry cord stump. And so you can safely remove a clamp after that. So really you just need to keep it on for a day or so. Now what about cord ties? Now these are easy to access or make. I've seen people make some beautiful crocheted ones, and there's a massive online market for cord ties because they're quite easy to crochet and make. You don't even have to crochet them. You can just use a cotton thread. It doesn't have to be anything fancy. But they're not as easy to use as a clamp. So they require the user to have some knowledge of how to tie it, because if you do it too loose, it virtually has no function. You might as well not have anything on it. So it requires the user to acknowledge that they really need to pull it tight. I would pull quite tight, tie a knot, tie another, go back around and retie it again a few times. Be definitely sure that it's incredibly tight. The other thing with cord ties is that they can easily stay wet if you've washed your baby or wet your baby, or if they get soiled by the nappy, by anything, poo or wee from the nappy, and it's hard to see if they're soiled sometimes depending on the colour. But it is a traditional apparatus. This is what used to be used, and they do look nicer than a clamp if you're going for a less medicalised aesthetic. The other thing is that you can take them off. They're a little bit more tricky because it's a thread. But you can snip them off, but typically people will leave them until the stump falls off. There are some people who believe that the cord ties open the baby up to more risk of infection. That is really the only objection that I've heard against cord ties is about infection. And then also I've heard from pediatricians who have had to treat babies who have lost a large part of their blood volume through the umbilical stump because the cord tie wasn't tied tight enough. So those are the objections that people can have to cord ties. So here are a few ways that you can counteract those possible downsides. And I will say that I did look for research on this, and there is no research at all that indicates that the cord tie increases the risk of umbilical infection for babies. People might have noticed that anecdotally. However, no one's written about it. And so if your care provider has an objection, ask them if they have any evidence that would show how much of an increased risk their baby is at of an umbilical infection if they use a tie versus a clamp. I can almost certainly tell you that they won't find any. But if that's the concern, you can also just remove a cord tie. So if you've tied one on and then in the following days the umbilical cord has gone dry and shrunk underneath the cord tie, you can gently snip off the cord tie and remove it. And that will mean that if the cord tie has stayed damp or gathered pathogens to it that are all sitting around the baby's umbilical cord, that you can remove it and take it off, and the baby will just be left with their little dry umbilical cord. The other thing that you can do to prevent the cord tie from getting soiled and to make sure that the umbilical cord dries out quickly, and this is the same with clamping, is to leave the umbilical cord out of the nappy. So you basically want them to dry out as fast as possible and not stay moist, because a nice, moist, warm environment is how you're going to grow pathogens and increase the risk of infection. But if it's all sitting outside of the nappy and has an opportunity to stay dry, then you're going to reduce the chance of infection. The other thing you can do if you're using a cord tie is to leave a longer length of cord. So maybe say 10 centimeters of cord. When we use clamps, we'll often cut it 3 or 4 centimeters short, but you can leave a longer length if you want to use a tie. It'll make it feel a bit more secure because you've got more cord to work with. So yeah, just cut a longer cord. It's okay. It'll still dry out. It looks a little bit more dramatic for the parents, but ask if they're happy with it. And then the next thing to do if you're using a tie is to just ensure that you've really tied it tight. And the thing that I do for parents who have opted to use a cord tie is I'll also leave a plastic clamp with them. And I'll say if you notice any blood leaking out from the cord, then I recommend that they just put the clamp on. You can still leave the tie on, but as a way of preventing any more blood loss, put the clamp on. And so if you're a midwife listening to this and your client's decided to use a cord tie, top tip is you can leave a clamp with them and let them know that they can apply it if they notice any blood loss through the cord, and both can be removed once the cord is dry. All right, we took a bit of a deeper dive into the world of cord clamps and ties today, and I know you learnt something new because I definitely did when I was preparing. And if you want to help put the Great Birth Rebellion podcast in front of more people, there is one very simple thing that you can do, and that is to follow or subscribe to the show on your podcast platform. It'll take a few seconds. It doesn't cost anything, but what it does do is it moves our podcast up the podcast ranks, and then the podcast platform will recommend it to more people. So just by subscribing, you can get the Great Birth Rebellion podcast in front of more people who need to hear this information. So if you haven't already, go subscribe. If you are a subscriber, you can go one step further and leave us a 5-star rating and a glowing review. Thank you for being here for today's episode of the Great Birth Rebellion podcast. If you want to get access to all the resources that we use to create every single podcast episode, you can join the mailing list at melaniethemidwife.com, or better still, the Premium Members Hub. Premium members get access to transcripts, the Ask Mel a Question button, an exclusive Ask Me Anything episode every month. All the details are in the show notes, and I will see you in the next episode of the Great Birth Rebellion.